Hi, this is Cindy, and today Justine's going to help me, and Jen's behind the camera, and we're going to do your neurological assessment. So we're going to start off with our patient. Hi, Justine. My name is Cindy. I'm a nursing student from Southwest Tech, and I'm here today to do your assessment of your neurological system, and essentially your face and your sensory system. So can you tell me your name and your date of birth, please?
Justine Spargo, 12/30/87.
Great, and that matches my physician's orders, and it also matches what you have on your wristband. Super. Any allergies, Justine?
Nope.
All right, good, that matches what I have as well. So I'm going to provide privacy for Justine by pulling the curtain around the bed or closing the door, and then I'm gonna go over and get some hand sanitizer, and so I've washed my hands. I'm not gonna need gloves for this, I don't believe. If we go along, if Justine had a runny nose or open skin, then we would put gloves on at that point. All right, so Justine, the first thing I'm going to do is look at your face for symmetry. So I'm looking to see, does the right side match the left side? And they do. Next, I'm going to look at your conjunctiva and the sclera in your eyes. So I can see the sclera, the white part, the outside that surrounds your irises, and they look nice and white and no signs of infection or redness. The next thing I'm going to do is ask you to take your glasses off, please. And then I'm going to ask you to pull your eyelids down a little bit so I can see the conjunctiva. Good. Your upper ones? Excellent. Nice and pink, no signs of redness or soreness. So the next thing I'm going to do is I'm going to check your pupillary response to light. So to do this, I'm going to cover the one eye, and I'm going to shine a light right in your eye. And I'm looking to see, does your pupil constrict when I do this? And so first I'm going to shine the light, and I'm going to watch that pupil. And then I'm going to shine the same pupil, and I'm going to look to see if it makes the other eye constrict, if they work together. And then I'm going to switch to the other eye and shine that eye, watching that pupil, and then do it a fourth time, watching the other pupil. All right? So let's start with that. So I'm going to shine a light in, and yes, it constricts. And now I'm going to do it again while I watch your other eye, and that constricts as well. Very good. And now we're going to do this eye. And I'm going to shine the light, and it constricts. And then I'm going to check it again, watching the other eye. Very good. Your pupils are constricting. They're equal and reactive to light bilaterally. All right, so the next thing we're going to look at is something called accommodation. So for this one, I'm going to ask you to look at something up close, and I'm going to expect that your pupils are going to constrict and be small. And then I'm going to ask you to look way out in the distance, and I'm going to expect that your pupils are going to dilate and become larger. So, and to do it, I'm going to hold the pen here and say, look right here at the tip of this pen. Usually it helps if you kind of hold the pen up. If you hold it down, it's hard to see their pupils. So I can see your pupils constrict. Now, Justine, I want you to look all the way to Prairie Sheen, right over top of the pen. And then I can see that your pupils dilated and got bigger. Great. And if you don't see it right away, you can have the person do it a second time. So go back of the pen, they constrict, and out to Prairie Sheen. They dilate. It's very obvious, and it's fun to watch. All right, so the next thing I'm going to do is check your visual fields. So in this test, I'm going to have you hold your head still, but follow the pen with your eyes.
Okay.
And we're going to do 6 different views. So up in the corner, straight to the side, and then down in the corner, and then up in the corner, straight to the side, and down in the corner. Beautiful. So what I was looking for there, Justine, is do your eyes work together? Does one go one way and one the other? But yours work perfectly together. And the other thing I look for is, I'm having a mental block now. When I had you look up this way, I'm looking to see do your eyes hold still or they kind of wiggle around, because that can be a sign of nystagmus or neurological problems. And you had no problems with that. All right, so the next thing we're going to do is just have you read just this bottom line here.
Inspect the tongue surface and movement.
Excellent. All right. So the next thing we're going to do then is look at your nose and mouth. So I'm looking at your nose for its size and shape. It's a normal size. It's not misshapen, or does it look sore? Its color's nice and pink. And have you had any trouble with discharge?
Nope, not lately.
Okay, excellent. So the next thing we'll do is palpate your sinuses. So I'm going to touch your face, and I want you to tell me if it's painful or sore.
Okay.
So we'll check your maxillary sinuses and your frontal sinuses. Okay. Do we just need to turn it all? Do you think would help at all?
It's okay.
Okay, super. Thanks, Justine. And thanks to Jen. All right, so the next thing I'm going to do is check the patency of your nasal cavity. So I'm going to ask you to put pressure on one side and breathe through the other. and then do the other. Okay, so you're painting them both sides. Very good. And then I'm gonna inspect the nasal cavities. I'm just gonna look with my pen light to make sure that everything doesn't look swollen and look the same on both sides, and it does. All right, so the next thing I'm gonna do is look at your lips, both inner and outer. So right now I'm looking at your outer lips. They don't look sore, they look, they're symmetrical. Now I'm gonna ask you to take your lip and kind of turn it down. Yep, and then they look healthy, and then your upper lip. And while you're doing that, I'm expecting you got it, your teeth and your gums. And they look, we'll look a little more in a second when I have a tongue depressor, but they look healthy from the front view. So the next thing we'll look at is, I'm gonna check your tongue surface and movement. So I'm gonna ask you to stick your tongue out and move it side to side. Very good, thank you. So Justine's able to stick her tongue out, the surface of her tongue is nice and pink, and she's able to easily move her tongue side to side. If she'd had a stroke or some type of a neurological deficit, she may have trouble with that. Her tongue might only go one direction and never go past midline. So the next thing we're gonna look at is I'm gonna take my tongue depressor, and I'm gonna have you say ah, and I'm going to look at your teeth and the inside of your mouth, and hopefully it won't make you gag, but I am kind of interested in that because it's one of the cranial nerves that I want to check. So,
Okay.
So I'm gonna have you put your tongue out and say ah. Does it make you feel gaggy? She's got no gag reflex. And
I can pretend.
No, your teeth and gums look fine. So we'll throw that away. And so now the next thing, so when I was looking for there was her oropharynx and the tonsil area, and I don't see any redness or swelling in that area. Any sore throats?
Nope.
All right, so that looks really good. So the next thing I'm going to look at is Justine's lymph nodes. So I'm going to start with her occipital lymph nodes. So those are in the back, and there's a picture in your book. And what I'm feeling for, I'm pushing my fingertips into Justine's neck, and I'm feeling for like almost a feeling of a rubbery little half a jelly bean. That's kind of the feel of an enlarged lymph node. You shouldn't feel that in a healthy person. So I'm checking for her occipital nodes, and I don't feel anything funky going on there. No, I don't feel any lumps. And then the post-auricular, that means behind, post means behind the ear, and pre-auricular, no problems. Now I'm checking the submandibular, or under her mandible, think back to A&P, and submental, which is just under her chin, no problems there. Then we're going to look for the anterior, anterior superficial. So think about that sternocleidomastoid, the one that when you push against my face, Justine, that muscle that shortens up here that you checked a couple weeks ago. So you're going to check in front of that, that's the anterior cervical, for any lumpy jelly beany feeling things, and then the posterior cervical, which is behind that sternocleidomastoid. And then the last one to check is the supraclavicular. So Justine, can you kind of shrug your shoulders up? And then you just run your fingers above her clavicles. I'm feeling for any kind of a lump or bump. And your lymph nodes feel perfectly normal. I don't feel any enlargement at all.
Good deal.
Yeah. And then the last, well, it's not the last thing in this section, I want to check your trachea. And so to do that, I'm going to put my hands over your trachea and ask you to swallow. And what I'm looking for there is I want to feel your trachea move up evenly on both sides, not one up or one down. So can you go ahead and swallow? Very good. All right. Now, Justine, have you had any trouble with your hearing?
A little bit.
Has it gotten worse lately?
No.
Okay.
About the same. Just a little hard of hearing.
Okay. Any hearing problems in your family?
Yes.
Okay.
My father.
Okay, what do you do to protect your ears?
Well, should wear earplugs, but I don't always when mowing the lawn.
It's hard to remember to do that, isn't it?
Yeah.
You see more and more people doing it, though. So now I'm going to look at Justine, the auricles of her ear, basically meaning the external ear. And I'm looking to see how do they look. And the reason we look at them is that ears can tell us some things. So there are some birth defects where babies will be born with really small ears and they're lower set, and that can be a sign of a problem in a newborn. Justine's ears look great. And look, she's wiggling them. So she doesn't have, she's fine, she's not an elf. So we're all set. And then the next thing I'm going to do is I'm going to palpate her auricles. I'm going to pull up on them. I'm going to pull the pinna forward. I'm looking for any type of pain.
No, no pain.
I'm gonna push on the tragus, and the tragus is the spot right in front of like where your earrings go if you're a lady, or if you see a male, or a male, lots of people wear earrings. And then the last thing I'm gonna push on is the mastoid process, and that is this bony prominence behind the ear. And the reason we push on that is when children, well, anybody could have it happen, get chronic ear infections, sometimes the mastoid bone will get infected as well. So we wanna touch that spot to make sure it's not tender. All good?
All good.
Great. Now, then I'm going to inspect Justine's external ear canal, and I have my otoscope here. I've made sure it has batteries in it. When I go in to see my patient, I'm turning it on. I can see that the light's on. And then I'm going to take one of these disposable tips. And just a couple things about otoscopes. So we're going to check Justine's hearing, and we're going to look. This is her external ear, and then we can look inside her ear and see as far as the eardrum. That's as far as you can see into the ear. So these can hurt people because they're sharp. So the best way to handle one of these when you're getting started is stand by your patient and then take if you're on their right side, take your left hand and pull their ear up and back for an adult. If it's child, you pull it down and back. That's the best for an adult. Up and back straightens their ear canal the best. And then you're going to hold the otoscope upside down in your hand, just like this. And that way you can, whoop, we're going to get another tip. We would never pick that one up off the floor and put it in Justine's ear. And so then I'm going to pull her pin up and back, and then make sure my light's on. And then I'm going to, see how I'm resting my hand against her head so I don't poke her by accident. And I'm looking down, oh, I see a pearly gray, her tympanic membrane, and I can see the little stapes bone neck on the inside of her ear canal. It's so cool. Up against her eardrum, and everything looks really nice and pearly gray and nice and pink. No sign of any kind of pain. And the other side, Justine?
Now, what would you do if one of my ears hurt?
Well, if one of the ears hurt, I'd be super careful not to poke you, and I'd also switch out and I would not use the same. I would start with the one that didn't hurt, and then I wouldn't want to take one that had been in an infected ear and then stick it in the other ear. Anything else I should think about?
No.
Fire away. Oops, see? So, your ears look good. Are you having any pain in either one of them?
Nope.
All right, super. Now, one more test to make sure that Justine can hear. So, Justine, I'm going to make a sound behind you, and you tell me which ear you hear it in, okay?
This one. This one. This one.
Very good. So she has good hearing. She can hear quiet things. Now, we're almost done, Justine. We're just under our neurological assessment. I'm going to check your gross motor skills. I'm going to do 2 tests. So can you stand up and walk about 3 steps, heel to toe, and then turn around and come back? Because I'm watching her gait, and she gets good balance. This isn't giving her any trouble. Maybe a tiny bit of wobble, but that's normal. All right, so turn around, stay out. So now we're going to do something called the Romberg test. So with your feet together, I'm going to have you close your eyes, and I'm going to hold my hands out so that you don't sway. And then I'm watching to see, does she sway? Maybe a little bit of wiggle there. All right, you can open your eyes. So that tells me that she's neurologically intact, because she's able to stand there with her eyes closed and be able to keep her balance. All right, I think you're good. You can do what you like. Throughout this test, I've been asking you questions that help me to judge your level of consciousness and memory. You're alert and oriented. I ask you things, you answer, your eyes open. And I asked you some things about your history, and you were able to tell me about them. So you're alert and oriented, and your memory's intact. Now I'm going to run through the cranial nerves. There are 12 cranial nerves. And so I'm going to start with testing your olfactory nerve. So you tell me, close your eyes, and tell me what you smell.
Lavender.
Very good. So her olfactory nerve appears intact. We tested her optic nerve, cranial nerve number 2, and we tested her reading. And we tested her oculomotor, her trochlear, and her abducens when we did the 6 cardinal, the eye movements, ocular movements. Yeah. And then, we're gonna check your trigeminal nerve. Now, your trigeminal has both sensory and motor functions, but we're just gonna check your sensory. So I'd like you to please close your eyes, and then I'm gonna touch your face with this tissue, and you tell me when you feel it and where you feel it.
Forehead.
Forehead, left side,
Left cheek.
left cheek.
Right upper cheek. Right forehead.
Very good, thank you. All right, so that was the trigeminal nerve. The next nerve we'll check is the facial nerve, and so for that one, we're gonna have Justine do some little actions for us. So I'm gonna have you puff your cheeks out, very good, frown, big smile. All right, now while she's doing that, I'm watching to see both sides of her face, is it corresponding? So neurologically, so the message is getting from her brain to her face, and her muscles are working well bilaterally. Do you just want to click that? Just, thank you. Anything? Thank you, sorry. Then, the glossopharyngeal is what we checked when we put the, tongue depressor in your mouth and asked you to say ah. And you were, we would actually call that a positive, because you didn't seem to have a gag reflex. But in all fairness, I didn't stick it down her throat super far. So, she probably has a perfectly good gag reflex. So that was your glossopharyngeal. The vagus nerve we tested when you said ah. The accessory, you actually tested it with your first test off, but push your shoulders up, please. Very good, that tests your accessory, and then your hypoglossal we tested when you stuck your tongue out and moved it side to side. So, we have to check for the Babinski reflex, which I forgot about. Are you willing to give up a shoe for that? Or you just
Sure.
want me to show them?
Don't matter. I got
All
new
right.
socks on.
Alright, so, I don't know if you care, I'm gonna unsock you.
That's okay.
So, to test the Babinski reflex for Justine, we start at her heel with something that's fairly sharp, like a pen or the bottom of a reflex hammer. And we start at her heel, and then we go up the outside callus side of her foot and around to the big toe area. So we stay on the bottom of her foot the whole time, from the heel, on the outside, and up toward the big toe. Now, Justine's having a normal response there. If it was an abnormal response, her toes would flare back this way. Kind of flare out and up, just like she's just doing. That's normal in a baby, but that should be gone in a baby in the first few months of life. That reflex stinks. If that were to happen to Justine right now, we would worry that she had some type of neurological damage, like a stroke or something wrong with her brain. So we would test this foot, and then you'll test this foot as well in your video. And you've got Justine, you have a sock back.
Not a big deal.
All right, and then one last test. I'm gonna have you do the finger to toe, the fingers to the thumb test. So I want you to go thumb to your first finger, second, third, fourth, backwards, and faster. Oh, she's good. Look at her go. All right, so she has good fine motor skills. So Justine, I think that is the end of it, of our assessment today. Is there anything else I can do for you? I have time.
No, thank you.
Thank you.